Let's prepare a secondary IV bag for medication administration. We'll need a few things to set this up using the patient's IV line that is probably infusing IV fluids already. We need the secondary IV bag of medication, secondary IV tubing, an IV extension hook, alcohol wipes, and gloves. First, we're going to clamp the secondary tubing. Then you'll hold the secondary IV bag and insert the spike of the secondary tubing into the port, securing it firmly. Then you can hang the secondary IV bag on the pole. You want to squeeze the drip chamber of the bag and fill the chamber about halfway. Slowly open the clamp and allow fluid to run through and prime the line. Do this slowly to ensure you don't lose excess fluid with medication. Then you can close the clamp. Be sure to check for air bubbles throughout the line. Always keep the cap on the end of the IV line to prevent contamination. Use the IV extension hook to lower the primary bag of fluids lower than the secondary bag. Next, you want to scrub the injection port of the primary tubing. This will be above the IV pump. Then you can connect secondary tubing to the primary tubing. Now you can program the pump, double checking the rate for the infusion of the medication or secondary fluid. Now you can open the clamp of the secondary line and begin infusion. For more information on infusions and all things clinical nursing, check out the Clinical Pocket Guide for Nurses. You can find it on my shop, Nurse in the Making.